Okay, so what is endpoint or what are endpoints? Endpoints are basically the objectives you want to determine about the studies. Like, for an example, you want to do the study about quality of life, how you can improve the quality of life, whether this drug helps in relieving the symptoms, whether this drugs helps in disappearing a tumor. So the objectives you want to achieve with your drug being investigated, these are called endpoints. That might be primary endpoints and secondary endpoints. Primary, that are most important. Secondary, these are comparatively lesser important. So these are different objectives or endpoints you need to first state in your clinical trials, and results are analyzed according to those endpoints. Now, credibility is one more thing, but the higher efficacy may not always be the aim of clinical trials. Like, for an example, if you are comparing the drug A with the drug B, so you are just evaluating that drug A is higher efficacious than drug B. That is not always the aim of the clinical trial. Some studies proves non-inferiority as well. For an example, drug A is not inferior to drug B. So that is also a way you can do a study. So that is called as non-inferior trial designs. So it's not always a higher efficacy you want to achieve and you want to do that kind of studies. You can also do studies to prove that this drug is non-inferior to other. Now, sample size having its important. If you want to do any studies, sample size is important. That how many number of patients or subjects you want to include in a study. It should not be a random that you wish to include 30 subjects and you did studies on 30 and now you are generalizing your results. No, there is a particular considerations you need to make to decide sample size, and minimum number of sample is needed for valid results, otherwise your study would be failed because you have not taken enough samples. So you need to consider both financial as well as ethical considerations, and there are formulas on which basis you can decide a sample size of particular study. So depending upon that formulas and different factors, you need to decide sample size and do the studies. So only after that proper sample size decisions, your study can become generalized or helpful. Now we are going into the errors of clinical studies. Now, on evaluation aspect of clinical studies or statistical aspects of clinical studies, there are different kind of error that can happen, and there are major two types of error there: type 1 error and type 2 error. Type 1 error is also called as alpha error, type 2 called as beta error. Now, what is the difference between two? It's very important to understand this. Now, this is your conclusion, and that is a reality or two part I've created. Like, for an example, you are doing a study of comparing drug A and drug B. So you find out in your conclusion there is a statistical difference between drug A and drug B, that is two groups. So between two groups there is a statistical difference that you found out on your conclusion, but in reality there is no difference. So that kind of error is called as type 1 error, and your conclusion is there is no difference, but actually in reality there is a difference between two groups. So that is called as type 2 error. So this is how you can understand things in a better way. So if there is in reality there is a difference and your study found out there is no difference, it is called as type 2. But in reality there is no difference and your study found out just there is a difference, it's called as type 1. So type 1 error mainly related to significance of results, and type 2 error indicates the power of a trial. That is the only thing you need to consider. Now, what are multicentric trial? As the name suggests, this kind of studies or trials is being done at multiple centers. So larger trials are involved in it, and they've been done on multiple centers, more than one centers, and these centers might be in different countries as well. where different teams of investigators are divided. Large number of patient which is been studies, because your study is being done at different countries and different centers, right? So here the results are applicable to wider population, so it becomes more generalized because more different ethnic groups are involved. You are doing similar studies in USA, you are doing similar studies in India, so different countries, different ethnic groups are involved in same trials, so that is more credible results they can get. Only thing is they need to consider the ethical guidelines of different countries, then you need to satisfy. And this kind of trials having improved credibility, so credibility of these trials enhances. So phase 3 trials, we'll discuss about the different phases of clinical trials. So phase 3 clinical trials, usually there are 4 phases, so phase 3 clinical trials are done in different centers, and these are called as multicentric trials. What are sequential trials? Sequential trial means your design is of trial is such a way that if you get a significant result, the trial gets terminated. So here the continuous process of evaluation is been going on from one end, and on getting the primary or secondary endpoints, the trial gets terminated. So these are called as sequential trial. Well, it's plotted continuously. The trial process is going on with the boundaries of predetermined level of significance. Once you get those predetermined level of significance, trial gets terminated, and this is applicable to only certain type of drugs only. Okay, so these are one type of a trial, you can say, that is sequential trials. Now we are going into the grade 4 of evidence-based medicine, and that is called as meta-analysis, and that is the most credible these days. We consider meta-analysis as a most credible clinical evidence, and on which basis we decide treatment guidelines as well, right? So here what they do, they evaluate the data by compiling the different randomized control clinical trials. So they consider different randomized clinical trials, and they combine all these clinical trials, and eventually they extract the data and they come to the conclusions, and that is called as meta-analysis. So large number of clinical trials, randomized clinical control trials which are already credible, and you are combining those results and you are concluding to an evidence, that is called as meta-analysis. So it increases the significance as the power, and they are the most useful tools these days to arrive at conclusions, and so that the clinical guidelines are decided.